60-year-old Carla Bukhari of Belleville has a long family history of early tooth loss in both her mother and grandmother.
I don't want to wear dentures. You know, I'm following my mom's advice. Keep your teeth as long as you can. Take care of them.
But even with reasonable care, she still ran into trouble.
My teeth were good. It was my gums that let me down.
And it was severe enough she needed a specialist.
My regular dentist, he did notice, you know, where I was receding, I think right here in the front, and he actually referred me to Dr. Nemeth.
Dr. Joseph Nemeth is a Southfield periodontist, a dentist who specializes in the care of the gums. Carla's situation was severe enough 10 years ago, she needed traditional gum surgery to save her teeth, involving cutting and stitching.
The recovery was a long time, and the sensitivity to hot and cold was bad, and it was hard to eat.
After surgery, she was told she needed to pay attention to her gums, but
a couple years after I had the surgery, I might have slacked off a little bit.
Which brought her back to Dr. Nemeth's office. He says, lucky for Carla, times have changed.
Dental lasers are a revolution in dentistry and in periodontal treatment.
His was the first periodontal practice in Michigan to use lasers when they became available.
We've had a huge variety of lasers and a huge number of varying experiences with lasers.
For example, the powerful pinpoint laser beam can be used to vaporize tissue.
If you're using it for cutting, it cuts the tissue, but it seals the nerve endings and seals the tissue in such a way that you don't have bleeding surfaces. And often, therefore, you don't need sutures or stitches.
But there are far more elegant uses for this advanced technology. By selecting the type of laser and the light, you can choose what you're cutting or removing. This laser, for example, only affects dark areas and glides over light areas without any effect. In your mouth, that means it only cuts diseased gums, leaving teeth and normal gums untouched. Here, Dr. Nemeth demonstrates on a delicate rose petal with a spot of ink on it.
And it'll actually remove all of that ink without damaging the underlying petal.
And this ability has given rise to the Laser-Assisted New Attachment Procedure, or LANAP for short. You see in this animation, a superfine laser tip is slid between the teeth and gums. Laser energy targets the darker bacteria and unhealthy gum surface. Next, any hard plaque on the tooth surface is removed. The laser is then slipped in again, this time to sterilize the bottom of the space between the tooth and gum, called the pocket, and a blood clot is left behind as a natural bandage, allowing it to heal and reattach from the bottom up. Carla, who's had both the traditional and now the new LANAP procedure.
With the laser is fantastic.
My own feeling is virtually all cases of periodontal disease, from mild to moderate and especially advanced, can be treated to some degree with the laser.
I just wanted to save my teeth.